Hello, this is Topic. Today I'd like to introduce you guys about the Tecar device. And first we'd like to introduce you guys the treatment handles. So as you can see, it comes with two treatment handles, the RET and the CET. And RET comes with 4 different sizes and shape tips and used for different treatment areas. And these tips, special designs, are used for the shoulders. It could completely touch the shoulder shape. And for the CET, it comes with 5 different sizes and shape tips. And these also used for the shoulder. And this one used for the acupuncture and could use for the eye surrounds, for the eyes page remove. And here is the return pack, and you can see this pack is big enough. And also here is the silicones around the pad, and the pack is very softed. Okay, now please follow the camera to look at the interface. So in it you will see 2 icons for the CET and the RET. So enter to the CET, and you can see that here is we could accept the energy from the low, medium, and high. So I'm setting low, and then we also could adjust these 2 buttons to make it. And for mediums, high, and here is the walking time setting. And here is the stop and start buttons. And this one is return buttons. And when we walking, and this will show you that the CT is walking. And during the times, it will show you the energy is watt. So it depends on different patients. These dates are different. So now I'd like to show you guys the outlook of the device. So this outlook is like this. All the light shades is fashions and classic. So this is the introduction of this device. Next, I'd like to show you guys about the treatment by this Tecar device. So now I'd like to show you guys about the treatment by Tecar device. And first, we need to put the return pack, touch the patient completely, and then put some gels on the treatment areas, and then setting the suitable energy, and then when the machine stuck. So first, we could fix in one treatment areas for about 4 seconds and then move. So when we're doing the treatments, we recommend to combine the CET and RET to do the treatment. Use the CET handle first, and then use the RET handles, because the CET handles is targeted to the surface rollers. So first we will make the surface rollers softened, and then use the RET handles doing the treatment. So it will make the RET handles energies delivered to the deep rollers more faster. So when we're doing the treatments, we could like this way to face in one treatment areas, or like this, make a circles, a small circles or big circles, and then we could move like Z. So for the CET treatments, about 15 to 20 minutes. It depends on the patient's skin conditions or on the treatment purpose. Okay, so and after the 15 and the 20 treatments by the CETs, and then we will change to the RET. So and next we'll use the RET handles during the treatment. So adjust the suitable energy and then make it stuck. And then we touch it. And you will see that it is working. So we also put these enlargement areas about 2 to 4 seconds and then move. You could like small circles or big circles. So the Tecars are effective for the pain relief and for the sport injury healings, and also could use for the women care. The RETs are my targets to the deep rollers, like the ligament and bone. So RET and CET combine to do the treatment. It will make the results more effective. And RET handles about use 15 to 20 minutes. It also need to depend on the patient's skin conditions and also depends on the treatment purpose. So the RET and the CET Tecars device are not only just used for the lower back and also for the whole back treatment, and also could use for the shoulder for the pain relief and the massage, and also if could use for the elbows if your elbows have feel pain, and you could use for the elbows, and also could use for the knee and for the leg and this part. So the Tecars could use for the whole body. So this all the treatments for the Tecars device. So we have done introduce this device and the treatment. So if you are interested in this Tecars device, please do not hesitate to contact us. Thank you for reading these videos.